So here's a room scan.
Then our phones are just out because he's airdropping me a video.
Okay.
Okay, these are just the 4 one-pagers. Nothing on the back of any of them. Okay, these are providers' orders right here. This is the MAR, all my equipment that I need. Okay, I'm gonna go ahead and get started. First, I'm gonna gather and cleanse my equipment, so I just got everything in the cart ready. Before I go in, I am all good. Go ahead and hello, my name is Trinity. I will be your student nurse today. Can I get your name and date of birth?
Joseph Smith, 10-5 of 54.
Thank you. I'm gonna go ahead and check your wristband. Provide privacy. You go ahead and add in hygiene. I will wear PPE gear if needed, but I don't need it currently. I'm gonna go ahead and check provider's orders. It looks like the provider ordered us just to administer your morning medications. How do you take your meds?
Just by mouth, pills with water is fine.
Oh, perfect. So
Yeah.
orderly. That's good. Do you have any allergies?
No.
Okay, awesome. And then any pain today?
No, not today. No.
Okay, so 0 pain. So we won't need to give your pain medications.
No.
So I'm just gonna go back to the cart and assess to see which medications we're gonna be giving you today. Any
Okay.
questions?
No.
And you're in comfortable position?
Yeah.
Okay,
Thank you.
perfect. And then the vital signs I took prior. Her heart rate is 74. Her respirations were 16. Her temperature was 98.6, and then her BP was 108 over 74. So everything looks good with her vitals. So now I'm gonna go back to the cart, make sure everything's good. Just making sure I have my provider's orders, my MAR, and then I'm gonna start with my first med check. Okay, so I'm gonna go ahead and start the med check. So I'm gonna start with Joseph Smith, 10-5-1954, 10-5-1954. Digoxin, Lanoxin, 0.125 milligrams by mouth, 0.125 milligrams by mouth, daily for CHF atrial fibrillation, for CHF atrial fib, and then the status is active, it is not given. Furosemide, LASIK, Joseph Smith, date of birth 10-5-1954, 10-5-1954, 40 milligrams by mouth, twice daily for CHF, it is active and it has not been given yet. Joseph Smith, warfarin, Coumadin, 5 milligrams by mouth, daily for atrial fibrillation, it is active and it is not given yet. And then I'm going to go ahead and do my pain medications. So Joseph Smith, oxycodone, I'm not quite sure if I said the date of birth, so 10-5-1954, 10-5-1954, now I'm going to start again. So oxycodone, 5 milligrams, acetaminophen, 325 milligrams per set. Oxycodone, 5 milligrams, acetaminophen, 325 milligrams per set. 1 tablet by mouth, every 4 hours as needed, PRN, for pain rating of 1 to 5, of pain rating 1 to 4, and then a pain rating 1 to 4. It is active and it has not been given. I'm going to do the second one. So Joseph Smith, 10-5-1954, 10-5-1954. Oxycodone, 5 milligrams, acetaminophen, 325 milligrams. Oxycodone, 5 milligrams, acetaminophen, 325 milligrams. It is Percocet. 2 tablets by mouth, every 4 hours PRN as needed, Pain rating of 5 to 10, it is active and it is not given. So that completes my first med check, or the provider's orders in the MARS. I'm going to go ahead and put my provider's orders away because I no longer need them. Then I'm going to go ahead and start my first med check. Okay, I'm going to go ahead and do the nursing considerations before I do my med check. So my nursing considerations for digoxin is assess and document apical pulse for 1 minute, and then if the pulse is less than 60, I would not give the med. Monitor INO, monitor resolution of atrial dysrhythmias by ECG, and then beer, avoid dosage if it's greater than 0.125 milligrams deciliters in atrial fibrillation. And then for us, furosemide, nursing considerations, assess BP before and during therapy, assess patient for hearing loss, monitor for skin rash, often Stevens-Johnson syndrome, use only if benefits outweigh risk for fetus during pregnancy. And then oxycodone, acetaminophen, nursing considerations, assess pain, intensity, location, monitor INO output, assess for dizziness, drowsiness, hallucinations, assess for respiratory depression, assess for constipation. And then warfarin, nursing considerations, monitor blood steady, assess for bleeding, gums, monitor BP, and then assess for fever, skin rash. And then I'm going to go ahead and talk about the labs. So the labs you would check the digoxin serum. The range for that would be 0.8 to 2 NN/mLs. It looks like during Joseph Smith's labs, his lab was 2.2. So because of that, I will not give it because it is too high, not of range. For furosemide, I would be checking the BUN, creatine, or sodium and potassium labs. The sodium lab was the healthy range is 135 to 145, and Joseph Smith's was 130. The potassium range is 3.5 to 5.0, and the range was, his lab is 3.2. So that both are too low, and I would not be giving furosemide because of that. Oxycodone. When I asked Joseph Smith the pain level, he insisted he was zero pain. If the pain level was zero, between or higher than 0, I would assess with pain and then give it if needed. For warfarin, I would check the INR labs. The normal range is 2.0 to 3.0. Joseph Smith's lab was 2.2, so I would be giving warfarin today. And now I'm going to go ahead and pull out my medication. I'm going to go ahead and pull it out of the drawer and grab warfarin. I'm going to start by comparing the medication first. So Joseph Smith, date of birth 10/5/1954, 10/5/1954, warfarin, sodium warfarin, so 5 milligrams daily for atrial fibrillation, by mouth, and then it is not given and it is active. And then I'm going to go ahead and put that in the cup, and then I'm going to go ahead and start my second medication. Check. Or I forgot to note from the first medication check, I did forget to note before I put it in the cup that the package is intact. The medication is not touched in the package. There are no rips. The expiration date is 10/6/2036, so that is good to give. And then I'm going to put it in the cup after I check everything. And then I'm going to go ahead and do my second med check, take it out of the cup. I'm going to go ahead and confirm Joseph Smith. Warfarin, Coumadin, 5 milligrams by mouth, 5 milligrams by mouth. I'm not quite sure if I just confirmed that. I'm going to start over just in case. Joseph Smith, Warfarin, Coumadin, 5 milligrams by mouth, 5 milligrams by mouth, daily for atrial fibrillation, daily. And then it has not been given and it is active. The expiration date is 10/6/2036. The packaging is not intact. The medication is still in the package. And then because of that, I'm going to go ahead and put it in the cup. I'm going to go back to the room and start my third medication pass. Go ahead and hello, my name is Trinity. I am just back. I'm still your student nurse for the day. Can I get your name and date of birth?
Yeah, Joseph Smith, 10/5/54.
I'm going to go ahead and check your wristband. Okay. Provide privacy. I'm going to go ahead and grab some hand hygiene. I would wear PPE if needed, but I'm going to go ahead and need that later when I administer the medication. Do you have any known allergies?
No.
And you still are okay with taking the medication orally?
Yes.
Are you in a comfortable position?
Yep.
Okay, perfect. Just going to go ahead. We are going to go ahead and administer warfarin today. That is just for, so it looks like I'm going to go ahead and talk about the action as well as the side effects of warfarin.
Okay.
So the actions, it is for blood clotting. It stops blood clotting, so it interferes with blood clotting by indirect means, depresses hepatic synthesis of vitamin K dependent. And some side effects would be nausea, cramps, rash, fever, or bleeding. Do you have any known bleeding going on today?
No.
Okay, perfect. Okay. Can you go ahead and just say that back to me? What the medication for, maybe some side effects?
Yeah, I think it stops prevents blood clots from forming, and then I could get like nausea or have bleeding issues or some stomach cramps.
Perfect. Okay.
Okay.
So because you did confirm those, I'm going to go ahead and administer warfarin, but I'm going to do my third medication check first.
Okay.
Okay, so I'm going to do my third med check, and that is just taking it out of the cup first and checking it again. Okay, so with the MAR, so I'm going to go Joseph Smith, warfarin, Coumadin, 5 milligrams by mouth, daily for atrial fibrillation, It is not given yet because I'm going to give it, and it is active. Okay, so that was my third med check. Gonna go put it back in the cup, and then okay, so I'm going to go ahead and provide hand hygiene just because I had touched a few things prior. Gonna go ahead and put on my PPE now. So, oops. Okay, I am going to, I'm gonna stop quick. I did forget in the beginning to cleanse my equipment, gather my equipment, and then I'm not quite sure if I forgot that, but just in case, I'm going to just say that I forgot to gather and cleanse my equipment. Okay, now I'm actually going to pass the med, and then she did the side effects. I'm going to pop it in here, and then this is your water,
Okay.
and then your med. If I can go ahead and watch you take that.
Okay.
Okay, perfect.
Oh,
And then I'm just going to go ahead and throw this away. Take my gloves off. Hygiene. Okay, I'm gonna go ahead and let you relax for 30 minutes. I will come back in 30 minutes to reassess how things are going, see if you have any of those side effects that we talked about.
okay.
If you do have any of the side effects, I'm going to go ahead and withhold your next medication. I'm going to go ahead and redo your vital signs, let the provider and pharmacy know, as well as document it in the MAR,
Okay.
or the computer. I'm going to document in the computer. Do you have any questions?
No, not right now.
Okay, perfect. Going to go ahead and make sure you're in a comfortable position.
Mm-hmm.
I'm going to go ahead and lower the bed, put up the rails, give you your call light. Here's your call light.
Okay, great. Thank you.
And then make sure the room is clear of any things, and then give you your table. Did you want that?
It's okay. I can reach it from
Okay,
here. Yeah.
perfect.
Yeah.
And then I am going to cleanse my equipment if I needed any equipment or had any equipment. Make sure to clear everything off and put everything away. And then I'm going to go ahead and grab some hand hygienes. My 5 hand hygiene moments are if you are before you touch your patient, before any aseptic clean procedure, after you come in contact with any bodily fluid, after you touch a patient, after you touch a patient belongings. I'm not quite sure if I noted, I'm going to document everything and report if any deviations if found or any side effects. Also document my medications. I did forget, I need to document that as well on here. So I would document, I give warfarin, I would put TVSN, I would put the date would be 2/24/26, and then the time would be 2:30. And then I would also document TVSN for digoxin, 2/24/26, 2:30, and then I'm going to circle it because I didn't give it. I'm also going to circle furosemide and then put my name, sign, and then date, and then the time, 2:30. Wow, that's very not enough room to write. And then I'm also going to circle oxycodone for both of them, oxycodone 5 milligrams, acetaminophen for the 1 to 4 and the 5 to 10. And then put my name, TV, student nurse, the date 2/24/26. The time is 2:30. Oh, shoot. Okay, wait. 1500. Okay, I'm writing in the wrong spot. So I'm going to redo this again. I'm also, because it's not the morning anytime, I'm going to write it next to the morning. So SN, sorry, I was writing in the wrong time or the wrong place. So 2/24/26, and then it's 2:30, and that's going to go here. and I'm going to go ahead and circle, and then put my name and initials here, date to 24/26 to 24/26, and then the time 2:30. Okay. 2:30. So I circled digoxin, circled furosemide. I did not circle warfarin because I gave it. I'm going to also circle oxycodone, the 1 to 4 pain, the 5 to 10 pain for oxycodone, acetaminophen, and then put my initials, the time, the date, 2/24/26, and then put SN for student nurse, TV, student nurse, 2:30 to 24/26. And then after I'm done, I'm also going to go ahead in this, and then I would also document again, like I said, I would document my MAR in there, and then document any deviations, hand sanitizer, okay, and yeah, I'm done.